Voilà, quand nous sommes dans Topik Konversasyon pour ça, mardi, le 27 janvier, Topik aujourd'hui qui nous peut aborder, nous peut causer le miscarriage et aussi en créole, nous capable dire un pet. Voilà, aujourd'hui, que docteur Suganya, encore une fois, il joint pour nous cause là. Nous avons l'éclaircissement là, par autres demandes aussi. Docteur, bonjour.
Bonjour.
Comment ça va?
Moi bien, merci. Comment vous ça va?
Moi très bien, merci. Bien content pour vous.
Yeah. Vous allez, vous allez.
Et docteur, il fait mon corps aujourd'hui au matin, tu as le temps, tu peux jouer un cigare. En effet, ça sent son cigare. Joseph Sino, moi demande, moi profite, moi demande, moi dit docteur, on de cigare. Il dit moi oui, il fait qu'à prendre de cigare. Bien content. You know how to dance the cigar?
Yes, I do.
With the long skirt.
Yeah.
Yeah. Voilà, là, pas faire nous comme là, bon, c'est loi qui peut prendre le cigare. Docteur Mini, il vient d'apprendre nous là, alors on aussi profiter pour danser. What about the mucha?
It's mucha. I'm still.
You still learning it?
Yeah, but the cigar, yes, it's beautiful, step by step, and it is very, very nice, and adding style, adding glory, adding beauty, and I enjoy it.
Enjoy it. Docteur, en Philippines, c'est loi comme si
One day we will do
One
that.
day you will
Yeah,
become
yes,
successful.
I
The
know.
Tony. Docteur fini. Merci, Jésus. Merci, bon, c'est loi.
Blessings.
Là, il y a pas prendre de mucha là. Now, you learning the mucha.
Yeah, but
So, parfait, nous comme nous pour c'est là nous là à cause docteur peut apprendre. Welcome back.
thank you.
And Happy New Year.
Happy New Year to you too. Adding style to 2026 with the new glasses.
On peut gâteau, on peut démontrer.
Yeah.
Et justement, nous Topik aujourd'hui, par exemple, dit nous peut causer le miscarriage, nous cause le pet. Doctor, thank you to address this subject, miscarriage. In Creole, we say pet.
Pet.
Yes.
Yeah.
What is miscarriage?
Miscarriage is loss of pregnancy. It can happen in early pregnancy or in mid-pregnancy. Until 7th month of pregnancy, we address it as miscarriages only. But in early first 3 months, it is addressed as abortions or pete, as you said. It is when the baby comes out and bleeds, that is addressed as miscarriage or abortion.
In other words, can we say pregnancy loss?
Yes, exactly.
It's the same thing?
It's the same thing. Both miscarriage and pregnancy loss are the same word. Holds the same meaning as well.
Doctor, what causes for all the ladies, all the women, all the mothers this morning who are pour autres qui peuvent get nous aujourd'hui bon matin, autres connaît qui m'a pour faire cap texte mon créole, docteur comprend créole, on m'a envoyé en anglais pareil, autres l'habitude quoi qui cause un miscarriage?
Okay. Before we go to the cause, I really want to address this issue. Any woman who's aspiring to become pregnant or who's dreaming of parenthood, when they dream of parenthood, they should be aware that the uterus is the place, the womb, where the baby is received finally, where it can grow very well. So, miscarriage, the reasons for miscarriage are equally divided between the male partner and the female partner now. All of us are under the presumption that the ladies are the only reason who's responsible for the pregnancy loss. But though we experience the blood loss and we see the baby losing from the womb, the quality of the embryo or the quality of the baby itself speaks for the pregnancy loss. So, the first cause of the pregnancy loss is the quality. Numerous causes like genetic. When we speak of genetic disorders or like not the perfect gene combo happening between the male chromosome and the female chromosome, if there is a disparity, again the baby is not going to survive. The third, if the baby there happens to be a pregnancy and then you don't get to see the baby at all inside the womb, just the sac alone, that is termed as missed abortion, where there is no gene at all, there is no chromosomal transformation happening, but the baby, all the attempts are manifested to form the baby. That term is addressed as missed abortion. And other causes like infection, weak uterus, fibroids, ovarian cyst, PCOS, polycystic ovaries, and thyroid disturbances.
What about stress, doctor?
Yes, of course. I forgot to address it in the first place. If you're too stressed, the cortisol level, the steroid level goes higher. Like, you know, Carol, like when we are too much stressed, like when you are about to give a big, for example, like an exam or an interview, or our heart beats faster. I mean, we experience this, everybody would have gone through the same pattern, where the total body's blood circulation is redirected to primary organs like the brain, the heart, the lungs, and the kidney. This is the flight or the fight mode. Either you fight or you fly away. So we experience the adrenaline rush, and the whole body is fighting against whatever we are gearing up or ready for. The similar way, when the body is under extreme stress,
Yes.
the steroids go up very rocket high, redirect the blood flow to the primary organs like the brain, the heart, the lungs, and the kidney, protecting it from stress. In the event, the uterus or the womb is receiving the lesser volume of blood circulation. So that itself will result in pregnancy loss.
One major factor is fibroids.
Yes.
Is it a threat?
Very much a threat.
Very
If
much.
the fibroids are sitting inside the womb, for example, I have brought again the model.
Sistema dokter nan menen model aujourd'hui bon matin avec lui pour nous gagner un petit peu plus, gagner l'éclaircissement, un petit peu clarification aujourd'hui bon matin.
Yeah. As you see, this is the uterus, this is the tubes, this is the ovaries. And when the baby is formed in the tubes, it swims up down into the red zone here. The T zone is the area where the baby stays in. So, if these are the white ones are the fibroids. So, if the fibroids are there inside the T zone, as you see inside the white ones here, these white ones disturb the womb structure, disturbing the baby's growth, not allowing it to grow further and causing miscarriage. So, this is another primary reason for early miscarriages. If the fibroids are lying somewhere outside here, it is not going to be a threat. But if it is sitting inside the womb like the yellow ones here, the white ones, white patches as you see, then definitely they are going to cause miscarriages. Another one, the polyps. As you see, there is a small red grape-like hanging structures inside the womb. If I can, if it's visible closer. So, these polyps again disturb the baby which is getting received here. Once it is getting once the baby transfers from here inside to the womb, this is the primary zone where it gets implanted, and this zone has to be completely free. The T zone has to be completely free so that it is receiving adequate blood supply for the baby that is trying to figure out its way to receptivity mode and the implantation mode.
Wanzi moun de la kou nou pe cause quantité menacée fibrome par nous dit capable menacer il y a facteur majeur en effet pour faire un pet voilà que le docteur explique un petit peu fibrome là mais seulement dans cette partie là nous l'utérus qui est capable affecter plus, but can it be treated?
Exactly, it can be treated. Now that with the advancement of technologies, fibroids are professionally treated, and the good thing about this advancement in technology is that these fibroids can be knocked out without disturbing the uterine architecture. That is done by laparoscopy. So, you pass a laser camera, and once we pass the laser camera inside and we reach this zone, we make a small incision or a cut area. We scoop the whole fibroid out, keep it out, and restructure the entire womb area so that the uterus is able to receive the baby in future pregnancies. So, these fibroids are absolutely treatable if they are picked up early and if they are addressed early in a proper manner, Now with a laparoscopy or laser surgery, this is very much possible after correction. One thing which I really want to highlight is anybody who has undergone a laparoscopic correction of the fibroids need to stay away from getting pregnant for a minimum prime zone of 3 months.
3 months.
Yes, it is mandatory, compulsory, because if you get corrected, like we get hurt, we tend to get a scar. So, for a scar to form outside the body, it takes minimum 3 weeks, but inside the healing process, total it takes 60 days. So, inside the uterus, we give an extra margin of total of 90 days. So, 3 months do not conceive, because the uterus needs perfect rest, and also the uterus needs the proper blood circulation. So, to recover, to restore the architecture, do not become pregnant following a fibroid surgery immediately. That itself will result in miscarriages. That then again, that is going to cause severe mental trauma to the lady. Again, the stress levels are going to go up. Now the lady is going to wonder, why did I lose the baby? Is it again because of any other reason, the similar reason of fibroids before, or now that I had got it corrected, why again I am losing the baby? So, no questions arise. You give proper rest to your body, have a good healthy lifestyle, and once the healing process is confirmed, after 3 months, go for a repeat ultrasound, make sure the uterine structure is good to receive the baby, then plan for the pregnancy.
Doctor, you say try not to conceive.
Yes.
Does that mean not have sex at all?
Please do have sex. Yes, no sex for 3 months now. Eh?
No,
okay.
for the benefit of the people this morning.
Yeah.
Yeah.
Oh.
Yeah. We want to be sure.
Yeah.
You can have sex, but do not get yourself pregnant.
Yes. See, because the correction happens only in the upper part of the uterus, and as we all know, this is the area where the sexual activity happens. Vaginal area is actually the area where the sexual activity happens, but make sure you don't become pregnant after the surgical procedure. And with the laparoscopy, the recovery is very much faster. 48 hours, you're back on track, your health is back on track. So, considering the lady or women always assume that I'm fit and perfect, why not get conceived on the straight go? No, it's never like that. The healing process inside what we done with laser takes time. So, you can have sex, but let it be a protected coital activity or protected sexual intercourse.
Ça veut dire faire si, prendre beaucoup de précautions, pèse bouton, les naïfs pour pèse bouton, ou otherwise rester bien tranquille jusqu'à sa process lui-même, healing process est important après 3 mois qui est capable réessayer, par exemple dans notre thème créole, réessayer pour nous capable get yourself pregnant. Somebody is asking, doctor, if a person is experiencing heavy bleeding, does that mean it is a miscarriage?
Okay, please address to the woman or the person who is asking, without having the pregnancy confirmed with the urine pregnancy test or a blood test revealing that she is pregnant, never assume heavy menstrual period as miscarriage, because it mimics the early pregnancy loss. But the pregnancy test has to be confirmed, and never to forget about this, diabetes. Now, the ratio of diabetes is very, very high. Coming to, since we spoke about the thyroid, I would like to address about diabetes as well. These two, this thyroid and diabetes, are like brothers and sisters.
Underlying conditions can be a major factor?
Underlying condition for the thyroid and diabetes is poor healthy lifestyle, and or genetic or hereditary, it gets passed on. And again, stress is a major factor causing your hormonal swing in your thyroid gland as well as in the diabetes or your sugar level. When these levels are fluctuating or not on regular control level, then it results in miscarriage. Simple reason. You can question me why thyroid is somewhere up there in the neck, why it has to cause pregnancy loss.
When it's down there.
And diabetes, when the whole body has got high blood sugar, and why it has to cause miscarriage. Simple reason, let me address the first one. The thyroid and the ovarian hormones which are supporting the baby, that helps the baby grow, are like twins, imitating each other in chemical structure, except for the chemical bond structure, except for few bond in few protein content. So the brain gets confused if the values are fluctuating. It doesn't know what to respond. We have an intelligence in the body that is responding to us in every time, every moment. That is how the whole system falls in place. So when the thyroid levels are fluctuating or high or low, then the baby is going to get affected. We can expect early pregnancy loss. Similarly, the diabetes. Imagine when we keep a sweet, it attracts a lot of ant.
Yes.
Okay, and it eats up the whole sweet. Similarly, when your body has got a very high sugar level, your body is naturally attracting organisms or the unhealthy ones. You are feeding the other structures, and the primary womb that needs the blood circulation again doesn't receive the proper blood circulation, landing up in miscarriages or early pregnancy loss. The loss can be due to this chemical bond structure that has been altered, and the brain is confused why these fluctuations are happening, and it doesn't allow the baby to grow.
C'est l'explication aujourd'hui bon matin quoi qui cause miscarriage par nous dit pregnancy loss. So it means that in the first time frame of the first 3 months is very important.
The first 3 months up to 12 weeks is very, very crucial. And those who are planning for, okay, let's put it in this manner: natural consumption and artificial consumption. Artificial is like IUI and IVF. We will touch it later. But naturally, when the couples are thinking about parenthood, please visit a gynae. Get a pre-pregnancy consultation. Get yourself checked up. Make sure your health is in perfect ratio. Your 𝐓𝐨, the ovaries, and everything is in good. Both the male partner and the female partner needs to take this pre-pregnancy counseling. And if they find any fault, most commonly anemia, the blood level volume where it is very low. When the blood volume is very low, anemia, it reflects on the quality of the egg. So it needs to be addressed. Basic multivitamins or folic acid supplements, or altering the lifestyle with adding lot of greens, or as you said this morning, with the egg glass. With the egg glass. You need to hydrate yourself, because our body composition is 70% water. So when we hydrate ourselves, automatically the organs receive enough hydration, so blood circulation is maintained. Roundabout, I am keeping on highlighting on the blood circulation, because the baby grows only by the mother's blood circulation. The mother is the feeder, the connecting cord between the mother, the channel, the umbilical cord between the mother and the baby is the channel that carries the blood. Can I have the slide so I can explain it good? The normal pregnancy and the lost one.
Et en même temps, qui nous peut causer nous pour mettre un des portraits qui docteur Inamene pour partager avec nous, pour nous expliquer, ben madame aujourd'hui, bon matin, le temps nous peut causer avec vous pour ben qui peut regarder, docteur peut mettre un peu plus l'emphase et l'explication. Doctor, this one?
Not this one. I have a division happening between a normal one and the abnormal one. The normal slide and the normal pregnancy. Yes, this one.
Okay.
Exactly.
Okay.
See, as you see there, you have the uterus, the baby, and you see two hearts there.
Yes.
The two hearts is where one is the maternal pulsation, the red one is the embryonic pulsation, the cord carries both. I have not highlighted there personally because they need to understand both have to function in synchronization for the healthy baby to grow. This is normal pregnancy. Coming to the miscarriage or the missed abortion, as you see, there is only the red one, which is the maternal pulsation happening, but the embryo doesn't have any heartbeat. So, in this condition, the baby doesn't grow any further. This is the whole idea behind me highlighting why the blood circulation is very, very important. And the picture very clearly states the womb in violet and the whole area is in red zone.
Yes.
The red zone, enough blood circulation, so anemia. So, again plays a major role. Again thyroid, where it narrows the blood vessels, or the diabetes, where the blood circulation is compromised. These are the fibroids which doesn't allow the blood circulation to happen. So, all these factors are primary reasons causing the pregnancy loss.
Voilà un petit peu, nous gagnons plus clair là aujourd'hui bon matin avec les bonnes portraits que le docteur nous a mené pour partager avec nous quoi qui fait un pregnancy loss, mais un miscarriage, un perte, pareil, nous dit ça veut dire si ou peut faire face avec ça bon symptômes pareil, does that mean they have to report?
Exactly. With the lady has to report or to visit a gynae immediately. Usually the bleeding doesn't happen spot on. They doesn't throw a rush of blood or a gush of blood. Always the compromise starts with dirty brown discharge. When they notice a dirty brown discharge, definitely they need to address, because when you notice a dirty brown discharge, it says the baby is getting some compromised, somewhere it is compromised inside the circulation or the maternal womb structure, whatever. So, when they address early, there are chances the baby can be saved. And then when they notice a blood clot, then again this has to be addressed immediately, because still there are chances for the baby to be saved. Yeah. So, the earlier they address the issue, the better the and when I am saying when the compromise happens, the blood loss or the dirty brown discharge. Now, the next question will be, what will it not affect the baby's health physically, mentally, the brain growth? How the brain growth or the organ structures will happen? Will my baby be healthy, normal? Yes, they will be. With the little amount of support, and if the baby's heartbeat is able to continue further, we can support with supplements and alter the lifestyle with very healthy ones. Focus, give adequate rest to the body, make sure the baby grows further in a healthy manner.
Let's stick on a discharge. Somebody is asking, any color of discharge, is it acceptable?
Now, it always begins with dirty brown, because white discharge or very liquid discharge in early pregnancy is very normal. And it is experienced because when you get pregnant, you see hormonal shifts happening inside the whole body. So, experiencing white discharge is never a threat. Experiencing liquid white discharge again is never a threat. But dirty brown, dark brown or bright red, yes, it is of significance. Coming to the artificial method, IVF babies. Now, again that also needs to be addressed, because all are under the conception like misconception, IVF babies, yes, we are giving our best shot to pick the healthy embryos and placing it inside. There is no doubt about it. But once the babies are placed inside, they have to wing out the receptivity of the uterus, the receptivity where the placenta tries to wing out. That's where the winging out happens, branching out like a feather opening or the flower blooming. So, you need to give the uterus adequate rest for the flower to bloom inside, and support the uterus needs to have the receptivity signal. And when I speak of IVF, we do IVF overseas.
Yes.
So, flying immediately, again in high altitude, the receptivity signal definitely can be hampered. So, when the couples have decided for artificial method, give yourself adequate body's rest zone, because we take a lot of effort to pick the correct sperm, good egg, fuse the baby together, make the baby fit, everything is fine from our side. And once the baby, until we place the baby in, we can support, but flying or that is where the couples need to understand resting phase is mandatory.
Risque là, le
Yeah.
temps nous peut travel à
Yes.
cause du
Until
système nous
at
pas
least
capable faire ça
35
ici.
days post embryo transfer, refrain from traveling, because if you travel to high altitude, again the oxygen supply is going to be compromised. So, when the oxygen supply is compromised, again we are going to land up in the same roundabout of blood circulation. So, this is where the loss happens with artificial methods.
Voilà un petit peu encore différents facteurs aujourd'hui qui nous peut adresser aujourd'hui bon matin ensemble avec ce bon symptôme aussi qui peut causer. Somebody is asking, what about backache? Does it provoke miscarriage?
Cramps are first signal because our bodies pick up signals faster. So, when we are experiencing normal body tiredness, generalized body tiredness is quite normal for any woman who is going through pregnancy. We tend to be very tired, we throw up,
Full of pain.
full of pain, having mood swings, everything.
Mood swings, everything.
Yeah, everything, bloated, feeling bloated, not having enough emotions to feel elated. In the first 3 months I am speaking of.
Yes.
Experiencing motherhood is totally different, but all time we want to lie down on the bed, nothing else, and we don't feel like eating anything. This is perfectly okay. But when you experience unusual cramps starting from the back, spreading to your lower abdominal area, then it is a red alert. Please visit the gynae, because this is never normal. The cramps become severe because these cramps again from the uterus try to compress the baby and try to push the baby outside. Can I have another slide that again explains in a good manner the slide which we had 4 images separate.
Un petit moment, on va mettre bonnes images en même temps qui nous peut mettre bonnes images. Docteur peut expliquer.
Yes, this one. This one. As you see, the baby is trying to grow. The cervical part is very, very important. The first half is normal. The second half, the cervix gives way. And the cervix is the portion what I am trying to highlight here. This is the area. This one, if it gives way, the baby just comes out. So, the baby, the contraction or the cramps starts from the upper zone and radiate to the lower zone. As you see, the head has now come down.
Yes.
And this baby will eventually land up in incompetent cervix, will give way and the baby just comes out. So, that is how the cramps cause this miscarriages, or there is a warning signal for us to know that the baby is getting something compromised inside.
Voilà pour qui demande sa question. It's a red flag. Il n'est pas normal si vous pouvez gagner sa bonne cramps par le docteur dit direct que le docteur elle va gagner justement docteur Suganya. Il a sa semaine que le docteur monte clinique ou gagner tous les jours until when?
Until Friday.
Until Friday. Et pour là, si vous pouvez avoir une expérience ou qui n'a bonne ou là ou dans les premiers 3 mois. Par nous dire ou dans cette premier 3 mois là on peut expérience un petit peu douleur qui vous sentez pas normal, la crampe nous dit un petit peu cramps. Docteur Suganya il a donné un petit call just walk-in, il est capable aider ou a gagner un petit peu consultation. En même temps docteur a fait un petit screening, il a get check ou a get si tout quelque chose est normal. Pareil nous dit especially for the first time mothers.
Yes. The first time mothers need to focus on their eating habit, the resting zone, these two, because when you feel like throwing up, we don't feel like eating during the first half or the first 3 months of pregnancy, but that is the primary zone where the baby is trying to bring out the receptivity signal, what I was speaking in the previous conversation we had right now. And eating healthy begins avoiding junk food. No
Junk
pizzas.
food at all?
No. These processed foods are going to damage the blood circulation again. So, high salt, high fatty, processed meat, heavy meat, and alcohol.
Number one.
Number one, no. Smoking, strict no. And junk foods, aerated colas, aerated drinks, any sodas, no. And processed like a lot of cheesy, juicy,
fizzy drinks?
Fizzy drinks, no.
Not at all?
No, not at all. These cheesy, juicy burgers that are very difficult to digest. Simple reason, these actually during the first half or the first 3 months of pregnancy, the digestive capacity of the body system slows down. That is nature's way of accepting the baby inside. You need to slow down, calm down to receive the receptivity signal. So, the digestion capacity which we had earlier is not going to continue during the pregnancy. So, at that ratio, then when the digestive capacity or the digestive movement inside the food, passing the food from the stomach food pipe is going to get slower, then they are going to have difficulty in passing poop. So, when they strain, when they push, and again it is going to cause cramps, and they are going to have a disparity in the acceptance. So, make sure you are eating rich fiber, high fiber, good protein diet. I do not say diet, that is the way we are supposed to live. Eat healthy.
Good food.
Good food.
Eat healthy.
Eat healthy, stay healthy, live happily.
No junk foods.
Yes.
At all.
At all.
No alcohol.
Yes.
At
no
all.
alcohol at all. A strict no. Nah.
Doctor said, nah. Now, doctor, now, can someone, can a woman, a lady, a mother, have a miscarriage more than once?
Yes. Recurrent miscarriages are very common. And these recurrent miscarriages, when they are happening, number one factor which we need to rule out is infection. We have a set of infection that causes recurrent miscarriages, like they are viral infections, not the bad virus like we speak of HIV or the the sexually transmitted viruses. These are another set of virus, the 5 combo ones, like we have the burger, the aerated sodas, it comes in a combo, fries, everything comes in a plate.
Very beautiful.
Like that, one virus steps in, the other 2, 3, 4, 5 also comes together, and all together they alter your immunity. So, when you have an immunity imbalance, they create immunity imbalance and they do not allow the baby to grow. They are responsible for recurrent pregnancy loss. Number 2 factor is the blood group. If the lady is negative blood group and the partner is of positive blood group, and when they have a baby together, and the first baby, if they are, the first baby is never affected, okay, but after the baby is born, it is mandatory to go for a baby's blood group checkup. If the baby picks up the father's blood group, the mother needs to be vaccinated within 72 hours. Needs to be protected against the father's blood group positive antigens entering inside her body. So, if she has taken that vaccination within 72 hours, the further losses can be prevented there itself, spot on.
Wow.
Otherwise, she is going to have the positive antigen circulating inside the body. Every time she conceives, she is going to knock the baby out. You know, the first baby is never affected here, but the successive ones is the next ones are definitely out of great challenge. This is considering the blood, because these are the basic ones that we never address or we fail to address.
Yes.
Here we speak of fibroids, we speak of ovarian cysts, though they are very common, and now they are becoming very common cause of miscarriages.
Miscarriages,
The
yes.
basic ones like the blood group, which we never fail
Address
to,
it, yes.
yeah, the way fail to even test once is mandatory here. Make sure if you are a negative blood group, keep yourself warned so that and you always, when you are in a negative blood group, make sure you have somebody in your close circle with the same blood group availability, because it's not easy to get negative blood group on the go when you bleed heavily. So always it is good to know somebody in your closest circle who can help donate blood just in case you require it.
What if both the both partners
Are negative? No worries at
No
all.
worries.
No worries.
Both positive.
Both positive, no worries.
No worries. Si vous tous les deux autres négatifs, n'a pas besoin d'inquiéter. Si vous tous les deux autres négatifs ou même positifs, n'a pas rien pour inquiéter. Mais si any négative, any positive, là ça fait ça, you have besoin protéger là. À cause premier passé normal, et ben deuxième, troisième qui vient là, il pourrait challenge pareil. Docteur et dit nous aujourd'hui bon matin quelque chose qui nous parti qu'on est ce petit bout là blood group. Et qui est nécessaire que nous peut tous aujourd'hui bon matin faire si autres tester après tester ça qui autres pour autres enfants. What about the first child?
The first child never gets affected.
Does it mean that they have to check the blood group as well?
No, the first child when they are carrying, the first baby when they are carrying inside, the baby actually protects the womb structure. The baby, the sac prevents the entry of the antigen inside the mother's body system. So when the baby is born, spot on within 72 hours the baby's blood group has to be checked. If it is positive, give the mother the vaccination within 72 hours. It is the baby, the first baby is never affected. The first baby's pregnancy course journey, everything is super good, fine, pleasant, it's super good, always super good. But when the baby's blood group is positive, checked within 72 hours, get the shot done.
Merci Ferry. Avant 72 ans, doctor, to conclude, how do the couple or the mother or the lady grieve after a miscarriage?
The trauma, the mental trauma, the acceptance that, see, you see double line in the kit. Immediately your serotonin or the happy hormone levels are very rocket high. The cherish, the feeling of motherhood flows from you from inside. That is a beautiful experience. But once they see dirty brown, then they are going to hit the panic button.
Yes.
And if they see blood spot, now the panic button is going to get into a high voltage button. And from the blood spot, the blood itself, then from the high voltage button, she is going to go on a roller coaster ride. And the emotions are so low down that she sees her very own baby coming out from the uterus and she is not able to accept it. Nobody can, not even me. I cannot even accept the fact that I am losing a baby right in front of my eyes. So, the traumatizing zone mentally is very, very, very high, and it is this moment the lady needs maximum support from the partner, where she needs encouragement because she is losing health on one side, she is losing blood, literally blood. So, she needs to replace the volume of blood she is losing on one side, and second, emotionally she needs support. It is still okay, we can try another time. It is still okay, eat healthy, take care of your health, like kind words spoken always makes volumes and volumes of energy inside her emotions, because we never speak like no, I am sad, I am she can cry, she can grieve alone, or she can cry along with a partner. It is different, but the trauma, it never allows her to rest or never allows her to sleep. So, if you don't get a proper sleep pattern, again the stress levels are going to go high. Again we are going to repeat the cycle. So, we have to break the chain, we have to break the circle and bring her health back in ratio, bring her mental health back in ratio, prepare her and make herself comfortable, make herself analyze why the baby was lost in the first place. As a gynae, that is our responsibility to make the couples understand why the loss. To some extent, we can understand why the loss has been. The receptivity signal most of the time happens to be the challenge. And second of all, it is most of the time the partner's support equally plays a major role. Give your body 3 months to 6 months rest, which means again no pregnancy immediately within the first 3 months. And you can have sex as we discussed earlier, but do not get conceived. So, give your body time to heal, and when you are ready, try for a baby. When you see the double line, straight away. And one more thing to conclude, do not wait for 45 days to see the urine pregnancy test. I do not know why this misconception. Now with the advancement of the urine kit, 35 days of delayed periods can pick up pregnancy.
35 days, do not wait for 45. 35 days can pick up pregnancy. Bon monsieur, zot aussi la bon matin docteur dit bon monsieur, zot besoin là pour support, zot madame, le temps il en a impède. Et texto.
Yes.
Le temps il en a impède, zot besoin là pour support, zot madame. Et nous sommes contents de continuer, mais seulement le temps pas de nous faveur. Docteur, beaucoup merci. Pour faire le temps pour jeûnement aujourd'hui bon matin, pour donner dernier la parole, merci.
Yes, I will. I'm looking forward. And my wish, more sweet home, bon santé, bonne santé.
Voilà. Il dit souhaite bonne santé, tout bon c'est celle-là.
Yes, bonne santé, tout bon c'est celle-là. As usual, I always say wish you all a very happy New Year. Stay healthy, eat healthy, with 8 glass. With 8 glass. And this is Dr. Suganya Saravanakumar signing off from Sugan Hospitals, Chennai. As usual, thank you, merci beaucoup.
I love this signing off from Dr. Suganya. Naina pode estar saco aí vir is sign off, c'est celle de cause do pet, Miscarriage, aujourd'hui bon matin, merci pour votre contribution. Aujourd'hui, moi espérer qu'il y en a quelque chose qui est capable d'attraper. Sinon, Dr. Suganya est pour là jusqu'à vendredi. Côté Dr. Mouti, ou capable donner un petit call, ou capable parce que Dr. Mouti demande pour voir Dr. Suganya et on va expliquer le problème qui peut passer à travers ça que nous avons adressé aujourd'hui, bon matin, de Topik Konversasyon. Et c'est là que nous Topik pour terminer. Donc, les petites secondes, nous pouvons passer au bon portrait qui on envoie pour nous.